Today's topic is cardiac output. So, what is cardiac output? It is the amount of blood that is pumped by heart per minute, and it is the mechanism where the blood flows around the body, especially providing blood flow to the brain and other vital organs. Normal cardiac output range is 5 to 6 liter per minute. In a person at rest while exercising, the cardiac output can be 35 liter per minute. So cardiac output, it is the volume of blood the heart pumps per minute. It is calculated by multiplying the stroke volume by the heart rate. So the cardiac output, it is dependent on the heart rate, contractility, preload and the afterload. What are the factors that influence cardiac output? Four factors: heart rate, preload, afterload and the contractility. So what does it mean when cardiac output is high? Sometimes sepsis, your body responds to blood infection that can lead to dangerous drop in blood pressure and organ failure that can cause high cardiac output. High cardiac output also can happen when your body lack enough oxygen carrying red blood cells, that is anemia. So what does it means when the cardiac output is low? When the cardiac output is low, that means there is inability of the heart to generate enough cardiac output. So that will lead to reduced blood flow to the brain and other vital organs. The symptoms may include lightheadedness, fatigue, and low urine output. The cardiac output is equal to stroke volume into the heart rate. Now, what are the factors that affect the cardiac output? The first is the heart rate. So, when the heart rate it increases, the cardiac output also increases. So, any factor that changes the heart rate will also change the cardiac output. Force of contraction: when the force of contraction of the heart increases, the stroke volume will increase, therefore, cardiac output will also increase. Blood volume: when the blood volume increases, the cardiac output also increases. Cardiac output it is expressed in three ways. One is the stroke volume, second, minute volume, third is the cardiac index. First, the stroke volume. What is stroke volume? It is the amount of blood pumped out by each ventricle during each beat. The normal value is 70 ml when the heart rate is normal, that is 72 per minute. The stroke volume will depend upon end diastolic volume and contractility. So what are the factors that regulates the stroke volume? It is regulated by three variables. End diastolic volume, that is the volume of the blood in the ventricles at the end of diastole. So it is known as preload. So the stroke volume will increase with the increase end diastolic volume. Second is the total peripheral resistance. It is inversely related to the stroke volume, that is known as afterload. Third is the contractility, that is the strength of the ventricular contraction. The stroke volume will increase with the contractility. Minute volume. What is minute volume? It is the amount of blood that is pumped out by each ventricle in 1 minute. So it is product of stroke volume and the heart rate. The normal value is 5 liter per ventricle per minute. What is cardiac index? It is the minute volume expressed in relation to square meter of the body surface area. So it is the amount of blood that is pumped out per ventricle per minute per square meter of the body surface area. Now let us discuss the variation in the cardiac output. Age. In children, the cardiac output is less because of less body volume. So the cardiac index it is more than that in the adults because of lesser body surface area. In the females, the cardiac output is less than in males. Why? Because of less blood volume. Cardiac index is more than in males because of the lesser body surface area. So greater the body built, more is the cardiac output. The cardiac output it is low in the early morning and it increases in the daytime. Moderate change in the temperature does not affect the cardiac output. Increase in the temperature above 30 degrees Celsius raise the cardiac output. Anxiety is the condition in which cardiac output get increased. During the first 1 hour after taking meal, the cardiac output increases. The cardiac output increases during the exercise because of increase in the heart rate and force of contraction. In high altitude, the cardiac output increases because of increase in the secretion of adrenaline. When changing from the recumbent to the upright position, the cardiac output decreases. The cardiac output is slightly decreased or unaltered during the sleep. The pathological conditions in which the cardiac output is increased is fever, anemia, and hyperthyroidism. In hyperthyroidism, you will see increase in cardiac output. This happens because of increased basal metabolic rate. Anemia due to the hypoxia, there is increase in the cardiac output. What are the factors that causes decrease in the cardiac output? Number one is the hypothyroidism due to decreased metabolism rate, atrial fibrillation because of incomplete filling of the ventricles, congestive cardiac failure because of weakening of the heart valves, shock due to the poor pumping and circulation, and the hemorrhage because of decreased blood volume. Now, what are the factors that maintain the cardiac output? The cardiac output it is maintained by four factors: venous return, force of contraction, heart rate, and peripheral resistance. Venous return. What is venous return? It is the amount of blood that is returned to the heart from different parts of body. The cardiac output it is directly proportional to the venous return, provided the other factors that is force of contraction, heart rate, and peripheral resistance they are constant. The venous return depends upon five factors: respiratory pump, muscle pump, gravity, venous pressure, and sympathetic tone. Respiratory pump it is the respiratory activity that helps the return of blood to the heart during the inspiration. So during inspiration, the thoracic cavity expands and it makes the intrathoracic pressure more negative. It increases the diameter of inferior vena cava that results in increased venous return. And the same time you will see that there will be descent of diaphragm that increases the intra-abdominal pressure and pushes the blood upward toward the heart, and that is why the venous return is increased. So respiratory pump it is much stronger in forced respiration. The muscle pump it is the muscular activity that helps in return of blood to the heart. The gravitation reduces the gravitation force reduces the venous return. So when a person stands for long period of time, you will see the gravity will cause pooling of blood into the legs, that is known as venous pooling. So because of the venous pooling, the amount of blood returning to heart would decrease. Second is the force of contraction. The cardiac output is directly proportional to the force of contraction. According to the Frank-Starling law, the force of contraction of heart is directly proportional to initial length of the muscle fibers being before the onset of the contraction. So the force of contraction it depends upon preload and afterload. The preload is stretching of the cardiac muscle fibers at the end of diastole just before the contraction. So it is due to increase in the ventricular pressure that is caused by filling of the blood during the diastole. So stretching of muscle fibers will increase their length, that will increase the force of contraction, and that will increase the cardiac output. So the force of contraction of heart and cardiac output, they are directly proportional to the preload, whereas the afterload, it is force against which the ventricles must contract and eject the blood. The force of contraction of the heart and the cardiac output, they are inversely proportional to the afterload. Heart rate, cardiac output is directly proportional to the heart rate. If the heart rate is increased, cardiac output get increased. Peripheral resistance, it is the resistance offered to the blood flow by the peripheral blood vessels. So the cardiac output, it is inversely proportional to the peripheral resistance. Now how can you measure cardiac output? We can measure cardiac output by the Fick principle, dilution method, pulmonary artery thermodilation method, Doppler ultrasound method, and impedance cardiography. There was a question in exam. All of them are the methods except for the measuring cardiac output. So choose your answer according to the option provided. So a person is severely dehydrated or lost a large quantity of blood through a wound. So in that case, there would be less blood for heart to pump. And what would be the effect on the cardiac output? Yes, that would decrease and the BP would fall. The autonomous nervous system takes plays a major role in regulating cardiac output. When the nervous activity increases during emotion exercise, it will stimulate the SA node as well as ventricular myocardium, that would increase the heart rate and therefore increase the cardiac output. Whereas the parasympathetic activities like during the sleep, that will inhibit the SA node, that would decrease the cardiac output. When adrenaline level in the blood increases, that stimulate the SA node, that will increase both the heart rate and the stalk volume, that would increase the cardiac output. The hypoeffective heart, in this condition the heart is pumping at very slow rate and the cardiac output decreases. So these are the factors that are responsible for the hypoeffectiveness of the heart. And hypereffective heart, it is the heart that is pumping at high rate and cardiac output increases due to the hypertrophy of the heart muscles or due to the nervous stimulation, that includes parasympathetic stimulation or sympathetic stimulation. As we know, high cardiac output, it is inversely proportional to the peripheral resistance. So following are some conditions that decreases the peripheral resistance, like beriberi, arteriovenous fistula, hyperthyroidism, and anemia. In fact, and the factors that causes low cardiac output, that would be abnormalities that causes the venous return to fall too low, abnormalities that causes pumping effectiveness of heart to fall too.